We had wonderful presentations this morning and collaboration regarding health and housing. And this panel, we're going to turn our attention to Central Texas. We're going to turn our attention to health and housing in Central Texas and to reimagining cities. And I'm going to start off by talking about a few buzzwords that are floating around these days. And one of them is smart cities. And what I always say is, what the heck is a smart city, right? We are, I think, in a time where we are using new technologies, and many times that's what people say when they refer to a smart city. But I would say a smart city is one that we're reimagining, and we're reimagining that city as a city that not just uses technology, but a city that is people-centered. A city is about people. A city is human-centered. A city that offers equitable access to quality of life for all of its residents. A city that thinks about how do we get people up those ladders of opportunity, right? My dad always said, you have to be healthy, right? If you don't have your health, what do you have? So we start with people being healthy. And then we need to have what I am calling hospitable housing. I heard the term this morning talking about a home. And I, in my thinking lately, have talked about hospitable housing. It's not just, is this a house that you can afford or a home that you can afford, but is it hospitable? Would you want to live there? Would you want your children, your mother, your father living there? Is this a hospitable place? And that gets to mobility, it gets to the environment, it gets to all the surroundings of your particular home, your housing. So we have health, we have our hospitable home. We need education, right? Then we need more workforce training. We need to enter the workforce and hopefully then arrive at the middle class. But we know that we have economic segregation, and we know that we have economic segregation here in Central Texas, and not everyone is sharing in our prosperity. Not everyone has achieved that equitable access. Not everyone has that hospitable home, and not everyone has mobility. But there is hope. We are on the road, and we're going to discuss some of those possible solutions here in Central Texas and take questions from you. But I want to start by asking the panelists, what to you is a smart city? Is Central Texas smart? Is Austin smart? What does this mean to you?
Well, for me, I think about a smart city as being one where people have access to the information that they need. So it's information access is first. But also part of being smart means being able to assemble that information in meaningful ways. So a smart city is a city where the stakeholders and the people who are supporting the residents of the city can create knowledge from that information. Mm-hmm. And then, of course, the dream of smart cities is intelligence. Do we have enough data? Do we have shared understanding of that data so that we can then develop those decision rules that really help advance our families? And at HACA and public housing, we have 4,500 people in public housing, 14,000 people in Section 8 housing. We are advocates for those folks, not just in terms of safe, decent, affordable housing, but in terms of family self-sufficiency. And so an intelligent, smart city is a learning city. It's a city where we can advance family self-sufficiency.
And I think, Catherine, you brought up a couple of really good thoughts for us to continue with, and that is that we need to have this public engagement. We need to not just think about people first, but we need to actually engage them. We need to have that digital literacy and digital divide, but also I would add that we need to have an effective city. People talk about efficiency. Yes, we want to make good use of our dollars, but we want our city to be effective. We want to, as you said, look at the data, look at the outcomes, and make sure that we're being effective. John Michael, what's smart to you?
Well, I think Austin is a smart city, and I think we could be smarter. I think we're on that road. To me, a smart city is less about technology and more about culture.
Right.
It's really the way that a city approaches its problems. I think first and foremost and foundationally, a smart city is one that actually recognizes it has problems and understands what those problems actually are. Austin could fall into the trap very easily of believing its own press, because we get a lot of really, really good press, We're at the top of almost every list of things you'd want to be on the top of. And so if we could fall victim to thinking that everything's great, but I think Austin is smart because we realize that although we are very prosperous and we have a number of great things, we have amazing institutions of higher education, we've got wonderful new medical school coming up out of the ground, we've got lots of great things happening here, but we have real problems. And I think that's where a smart city starts, with recognizing that it has problems. And then beyond that, I think a smart city does embrace technology and does embrace innovation, but doesn't embrace those things for themselves or for their own sake. Technology and innovation are not ends in of themselves. You know, they're just tools. It embraces technology and innovation to actually solve those problems, to solve real problems. You know, we don't want to foster innovation and creativity around apps that don't really do anything, or create these giant repositories of data that we don't really have any use for. We actually want to harness those things to solve real problems. I think that's what a smart city does. And again, I think it goes to culture. It's a culture in the city that fosters and maintains and nurtures a safe place to be creative, a safe place to try things. It's a culture that allows people the latitude to be bold, to try big things, and to not be afraid to fail. That's how we learn. We learn by failing, right? And it should be a place where it's safe, especially for our big institutions like cities, like healthcare districts, like universities, to try things knowing that sometimes you're going to fail. As long as we fail quickly, we learn from that, and then we try something else. And as long as we're going through all of that in an earnest attempt to actually solve those real problems. And then, of course, we have to be open and inclusive and transparent. We have to share data so that other people, other communities, and other sectors within our community can learn from our mistakes and try new things. So to me, that's what a smart city is about. It's about creating that culture in the city to be bold, to be innovative towards solving our problems. And so, yes, I think Austin, by and large, is a smart city. We have that culture here, but we could always be smarter.
Wonderful. So we've talked about SMART is being inclusive, having public engagement, data, outcomes efficient. SMART is a culture and probably cultural competency, I would add to that, and also asking the right questions, engaging. What are our challenges? And then asking the right questions around those challenges. And if we're using technology, it's not a shiny new toy, it's to actually meet those challenges. Thank you, John Michael. Dr. Tierney, what's SMART to you?
Let me turn your, can everybody hear, by the way, all of the clicking the plates and everything? I guess if you can answer the question, the answer is yes, I guess. Let me turn your question around. What's a dumb city?
Perfect.
Okay. A dumb city is one that doesn't look ahead. A dumb city is one that doesn't know its own, doesn't have a vision for the future, doesn't know what it values, doesn't have any specific or even general goals, and just lets stuff happen. So, let's housing be responsive to an influx of people rather than seeing there's an influx of people coming. How should we build housing? How should we build transportation, et cetera? A dumb city would allow an organic way of displacing people from parts of the city to go to the places that are not ready for them, so they don't get the services they need. There aren't the educational services, the health services, the transportation services, the food services, any infrastructure. So a dumb city is reactive, okay? A smart city is proactive. It decides what it wants. It has a soul. It's got a mission. It's got values, and it explicitly develops those through a consensus process of the community. So it isn't imposed by whoever's a leader. It's surfaced from the people that live there, and each community is different. I would argue that Austin's probably different from other places in Texas. It's different in other places in the country.
I've heard that before.
And I think it's surrounded by Texas.
There's T-shirts with that.
And so it should have a sense of itself. And I get some sense that that's the case. I don't get the sense that it's been an inclusive conversation. And so that's where it starts. It starts with knowing yourself, knowing what's important to us as a city, to us as residents of this city, and then building upon that with a strategic, thoughtful, proactive plan based on information, able to predict. I actually looked it up before this meeting. Austin's going to grow by 20,000 people this year. And next year it's going to grow by 20,500. Next year it's going to be, Austin is growing by a city every year. And that can happen either by just letting it happen, which means it's going to happen in ways that doesn't serve the largest number of the community, or it could happen in a planned way that focuses on something. And in this case, I'd argue it ought to be health. Because we've already heard that housing and health drive everything else. They drive the economy. They drive essentially the future of the city. So I'd argue a smart city actually steps back and says, who are we? What do we want to be? And how do we get there? And then everything else, the major decisions, the micro decisions, all come from that grounding.
Wonderful. We're inclusive. We have data. We're efficient. We make sure that we ask the right questions and meet the challenges and use our tools to solve them. And we're not dumb. And we're the opposite of that, which is smart, which means that we plan. We have planning, we're proactive, we have strategic planning, and we start with that planning. And certainly we have a lot of planning challenges ahead of us. This morning, we heard about displacement and what I refer to as involuntary displacement, when people don't choose to leave where they're living but can no longer afford to, so the involuntary displacement. We heard about many other health challenges, whether it's asthma or lead and many others. And I would say that this was a perfect lead into the next question that I wanted to ask you all. I think that when we plan, we see that there's a nexus between all of this, that we cannot look at things in a vacuum, whether it's health or housing or workforce, education, all of these issues, and of course, mobility and transportation. We did just have some mobility bonds passed, right, John Michael? I think it was $720 million. And certainly in Central Texas, we know that two of the biggest challenges we're facing are affordability and mobility. And of course, embedded in those are health and housing. You cannot talk about affordability and mobility without talking about health and housing. So and the next question I have for you is, how can we better address these affordability and mobility challenges that we are facing here in Central Texas? Anybody?
Do you want to take that one first?
Well, I'll just start from the perspective of our housing authority residents.
And you're working on a very exciting project with a new grant, so please do.
And we are. And so our residents earn between $10,000 and $14,000 per year. They're truly the neediest of the needy in Austin. And what I loved about Sonia's story is that there's a tremendous network of service providers that are referring folks to each other. Our family self-sufficiency coordinators are making those kinds of referrals, and Jobs Plus all the time. They're the unsung heroes, the glue. But, riffing on the idea of an intelligent and a dumb city, maybe there are intelligent-ish areas of the city and dumb-ish areas. And the future is not evenly distributed in Austin. 96% of our city has broadband access, has had for a long time. In 2007, we were lauded as the most connected city in America, so we have a lot of years of experience. But only 15% of people in public housing have internet at home, and half of those have consistent internet at home. So one of the major barriers that we have and successes that we have as a smart city is that Capital Metro and on-demand economy, the TNCs, the transportation networking companies, are all enabled by the app economy.
Right.
Well, our residents don't know how to use those apps, and our residents have real healthcare needs.
And real transportation needs
associated with that. So in August, we were awarded recently a grant from Next Century Cities and the Charles Benton Foundation, and that grant is specifically to help residents learn how to use smart technologies to navigate transportation. And what we're finding is the places that they want to go are to dialysis, 144 times a year, to go to the doctor if they have diabetes 24 times a year, to do preventive maintenance and physical therapy, which are often very hard to reach, 200 times per year. So for us, that's kind of the nexus of those things, and we're just beginning that journey.
Thank you, Catherine.
I'm a physician. I tend to think, so what's the lesion that needs fixing? You know, so what and how do you prioritize the lesions you're going to fix? You know, if you've got somebody who's critically ill, you got to stop the bleeding, right? And then you have to work on you know, maybe less issues. I think transportation is the lesion. I think that you know, people don't want to live in the suburbs if it takes 90 minutes to get downtown, which it does. People don't want to live in a part of town that keeps them isolated from the things that they want. And transportation, I'm sorry, transportation in this town really sucks.
Tell us how you really
and
feel,
I don't
Bill,
think $750
please.
million is going to fix it, because it's going to fix I'm going to use a term that in medicine, it's polishing a turd. Okay? Is that
Highly technical term. Remember that, folks.
We're trying to fix a road situation when roads probably are not the answer. There may be a short-term answer, but the answer, whether it's the answer to if you you know, care about your carbon footprint, if you care about efficiency and movement, et cetera, is going to be some kind of mass transportation. Cap Metro does the best it can with the budget it has. Every one of those buses costs $250,000. Okay, so how much can they do, you know, with that kind of transportation system when it's competing with you all in your cars, and the people taking their life in their hands on their bikes for the same roadways? So I think that it's going to take some reimagining to make that happen. Until that happens, you're going to see this expanding donut hole where they've got the inner city being rapidly replaced by glass, you know, actually Austin losing what made it cool, kind of a funky town. You know, look at Rainey Street. It's not funky anymore, right? It's glass towers, and that's what you're developing in this town, in this concentration downtown, which is great. I live there because I can walk to work, right? So I'm part of the problem. But that was the option that I had coming in. I was damned if I was going to live in a suburb and drive an hour and a half to get to work every day. So I think transportation is actually the lesion, and I think it takes a complete reimagining of it. And I know the ground's really hard here. It's really hard to dig under stuff. And we're talking about gondolas and things. I think it's going to take some really outside of the box, kind of really creative thinking to solve this problem. But there are solutions out there. We just have to embrace the fact that there's going to be a one-time expenditure that's going to be painful. That's going to make what we passed recently, I think, is going to dwarf that. But once you have that, if it's something that is future-facing, then I think you'll get to the kind of city that you want, where you can live in any part of the city and be able to have the kind of lifestyle and support you need to do the things you want and have to do. But I think transportation is really the lesion here.
Well, John Michael, I happen to know that you spend more than 24 hours a day thinking and working on these issues. So, what are your thoughts? I know you might have a few.
I agree with almost everything that Dr. Tierney said, but I want to disabuse people of the notion of what was in this bond that just passed. There are no new roads in this bond.
Right.
And that really gets at the heart of what we need to do with transportation. Is we do need to reimagine transportation. And this is really, if you take a step back, the real way forward with urban mobility and urban transportation. We have to do more within the same amount of space with the infrastructure that we got. What we're moving towards, and I think it's very applicable to this conference, is asking more of our infrastructure, right? So, you know, to the untrained eye, you could look at a $720 million bond package that has a bunch of streets in it and think, okay, well, they're building a bunch of roads. Actually, what we're doing is transforming these roads to do more. So yes, we're going to have a meaningful impact on congestion, but we're going to build sidewalks where sidewalks don't exist, right? We're going to use this opportunity to transform this infrastructure to deal with our flooding problem, because we can have green infrastructure and new drainage infrastructure. We're going to prepare these corridors for the massive increase that we need to have in housing supply along these corridors, aligned with our land use plan. We're going to build protected bike infrastructure and more pedestrian infrastructure so that people can have healthier lives because they're able to walk to more things right now. You know, without these kinds of improvements, it doesn't matter how many buses Capital Metro puts out on the street. If people can't actually get safely to the bus stop, it doesn't work. And I would say the one thing I do disagree with is actually it's very easy to tunnel under Oz. It's all limestone, right? You could probably cut through it with a spoon if you really wanted to, but
All right, get ready, folks.
it is very expensive, though, I would say. But in any case, this is really this larger thing. We in an urban area, we don't have a lot of space. The real limited resource we have is space. And our right-of-ways are not going to get any wider for the most part. So we have to figure out a way to do more within the available right-of-way to support all the other objectives that we have beyond just moving cars, moving people, giving people safer, healthier ways to get around, supporting transit, supporting better and more sustainable land use. And that's really what this mobility bond was about. I like to say, now that the election's over, I can tell you, we hid the vegetables, right? We hid the vegetables. We got everybody,
What, did we start with dessert?
we got 60% of this city to vote for the largest investment in active transportation that we've ever had in this city, in bicycle and sidewalk infrastructure. And that's because we were able to put together a package that did address what is the biggest pain point that people have in the region, and that's their peak hour commute. But we were able to do it in a way that also asked more of our infrastructure and addressed many other challenges beyond just peak hour congestion. And I think that is the way that we're going to have to move forward. We do need to invest in high-capacity transit. We do need to continue to invest in active transportation infrastructure, and we will. But this was a good step forward. And I think that gets at your question, what can we do to make even more progress on affordability and mobility? I think we had a good start here, and that is getting out of our silos, right? So we put this mobility bond on the ballot, and so, you had your old reliables come out to support it, real estate community, your chambers of commerce, folks like that. It's great. But we also had the American Heart Association out campaigning for this bond. We also had Housing Works endorsing this bond because those of us in this room understand that investments in this kind of transportation infrastructure have positive health outcomes. They have positive housing outcomes. They're great. The problem is with campaigns, you can't explain that to everybody. There's an old adage, if you're explaining, you're losing. It's congestion, roads, but we're actually getting a whole heck of a lot more out of these investments than just addressing congestion, which we are going to do, but we're also going to have a lot of other positive outcomes as well.
And that's very important. We've had a theme that we've heard this morning, which is one that's near and dear to my heart, and that is collaboration and getting out of the silos. Whether it's collaborating with the public, private, nonprofit, academic sectors, with people first and engagement, whether it is collaborating across agencies or within a large city, such as the city of Austin, collaborating across those departments. And I think that is very important. Yes?
I want to pick up on something that Catherine said, and that is that for people with any kind of chronic illness, and even for many people that don't have a chronic illness, the number of times you have to touch the healthcare system, if you add them up, is enormous, okay? And it's the way we do it is kind of nuts. I mean, we take people who are disabled and we make them come to us. Right? And we take people who are sick and make them get out of their sick bed and come to us so we can spend 5-10 minutes with them. So the question is, and when you throw in a transportation system that makes it difficult to get around, at least in the interim until you solve all our problems.
But you're right, this one thing isn't going to do it all.
We just have to, then we have to use transportation wisely in the health sector, since we're talking about health here.
Right.
And so one of the things is that you ought to be able to talk to your provider without having to actually be face-to-face with that person, except when face-to-face is necessary.
I think we may need some changes in state law to assist that, too.
And it often is not. So telehealth solutions and having community health workers, having them coming to you, having house call program for homebound elderly, et cetera. Those are all things that are cost-effective and can be paid for in the current environment. It's just we haven't developed that because the old model's paying us too well. Well, at least the primary care physicians in the old model are getting tired of seeing a patient every 15 minutes, and the patients don't like it either. So I think we have to find new ways of setting expectations for when people are seeing their providers. I'll see somebody, it may not be my physician, but I don't need my physician today. I'm having a burning when I urinate, and I need to be evaluated whether I have a urinary tract infection and get a prescription for it. That probably doesn't take a physician. It turns out that this is a great community for that. A recent survey by the city of Austin shows that 92% of the people in this city have broadband access. It may not be through the internet in their home, it may be through their cell phone, but they have access. And so we need to utilize that so that the transportation doesn't become an inhibiting barrier for health.
And just
I just want to interject quickly. You all have cards, so if you have questions, now is the time to write them down and pass them up here, and we'll incorporate those. Thank you.
Just picking up on that, a couple of things have happened recently that are very instructive, hopefully for us. First, the Federal Reserve Bank ruled in July that digital inclusion investments are eligible for CRA credits.
Thank you.
Second, thank you. And also in July, the Federal Communications Commission modernized Lifeline services. So now, people who are low income that would normally get Lifeline services for telephone now will get Lifeline services for internet. So internet has been deemed a Lifeline service, and that's why. I just want to share with you, we through a partnership with Austin Energy, HUD, and the Department of Energy have begun installing Nest thermostats at our Shadow Bend property. So we're looking at how can we be a smart home. And part of the reason we're doing that is because our residents with programmable thermostats cannot opt in to Austin Energy's demand response program. We installed the first few thermostats in the first home. One of the residents said, well, if the thermostat doesn't sense me moving, then that means that my neighbor and my other neighbor who are bedridden, their thermostats won't know that they're home. And we said, yes, that's correct. And then somebody brought up the phone and said, but you mean they can adjust the thermostat with their phone so they won't have to call me to come home from work during my lunch hour, or they won't have to call that caregiver to come and adjust the thermostat because they're uncomfortable? So that's just a concrete example of, I don't know the numbers. How many times do caregivers run out to the home to adjust the thermostat? There's a role for reducing the number of visits through those kinds of smart home technologies.
It's also, thank you, Catherine, a perfect example that this is about people and about being human-centered, right? That's what we're about here. I do have a question, and thank you for the question, and it is, how do you define affordable? Affordable housing, food, education, healthcare, so on and so forth. Oh, you all get to answer this one. How do you define affordable in these different sectors?
Well, from the HACA perspective, HUD defines affordable,
Right.
and people in public housing always pay 30% of their income in rent. What I do know is the transportation cost burden. This is what we're trying to uncover with this new grant, so we can look at the cost savings of bringing healthcare to homes instead of having people go out to healthcare. What I know is that our residents are spending, sometimes the ones that are connected, $100 to $150 per month on broadband, so they can stay connected to family and friends, and often caregivers as well.
And I think what you were referring to when we talk about HUD is the definition of cost burden. If you are paying more than 30% of your income on either rent and utilities or mortgage and utilities, and then we look at you're truly cost burdened if those costs plus your transportation costs are more than 40% of your income. John Michael?
Well, yeah, I think we are getting beyond just looking at the cost of housing. There's a, when we talk about affordability in Austin for many, many years, we've really focused on housing costs, as we should. But I think more and more people are seeing that it's not just about the cost of housing, it's about the cost of living. And if you look at the two largest items, typically are housing and transportation. And that's an average. I can't recall exactly who did it, but I've read some research lately that kind of disaggregated the different income levels in some of the major metro areas, and working class and lower income families in many instances are paying more for transportation than they are for housing. And you see this, right? You drive 20 miles outside of downtown Austin to southeast Travis County, you'll see a small home with 6 cars parked out in front of it, because every single adult in that household has to have a car to eat, to go to school, to go to work. There's no other option. So they're spending a lot of money on transportation and not nearly as much on housing. And I think that, if you think about the lasting and generational impact of that, at least if you're, let's say if you're fortunate enough to own a home and you're cost burden, at least you're investing in something that you hope appreciates and that's going to have lasting value that you can transfer to the next generation. If I buy a car, it's worth, 60% the moment I drive it off the lot. And, at least the way I drive, when I do drive, it's not going
I'm
to
not
last very
commenting
much
on that
longer.
one. Not going there.
And so we have these families who are not really able to build wealth for future generations. As we all know in this country, that's how you really get money, is you inherit it, right? You inherit wealth. And so I think we're not only creating a difficult life for them, for families when we create that situation, but we're making it increasingly difficult for families to pull themselves out of poverty in future generations.
Several more questions that I want to get to. And there's one here that talks about owning a smartphone and digital access, but I think what they're trying to get at this is that you need more than the smartphone. There are lots of people who, they may own a smartphone, but they don't have a data plan. And even if they have a data plan, they may be unbanked, not just not having a credit card, but unbanked. And so I think that these are real issues that we deal with access, and that affects their access to transportation. People talk about using ride-hailing. Well, what if you don't have a data plan? What if you're unbanked? And even given that, can you afford, I doubt it, $10 each way from that? Are we going to subsidize it? There are lots of other issues here.
One of the things that when Connect Home was initiated by the White House and HUD, we got a call from the New York Times, and they said, why are you giving residents of public housing computers?
Right.
When smartphones are king. And we said, smartphones don't do everything. First of all, it's very difficult to do homework on a smartphone. And you do need broadband to do homework on a smartphone, and which is often done at a McDonald's or a Walmart in a car that's idling. So the parent
Think
knows
about the health consequences of that, right?
So the parents know it cost me $2.40 for my child to do their homework last week because I was idling outside McDonald's. But computers' memory is much cheaper. So when we store our family photos on a computer, when we store our health documents on a computer and not in the cloud, we don't have to pay every time we access our health documents. So we give residents computers, even those residents that don't have internet access. We deploy those computers with Medline Plus in Spanish and English with the Khan Academy medical videos. And those are the two of the most popular things that residents look at. When we deploy the computers, people will immediately go to the Khan Academy medical videos and say, I have such and such, or I need to know the difference between salt and sodium, and they'll use those videos. So with smartphones, we have to teach people how to use them. There's something called the Facebook effect. When Pew went out and surveyed 10,000 people over the last 5 years and said, do you use the internet? Yes. Do you use apps? Yes. Give me an example of something you do on the internet.
So we have
Facebook.
Lots of questions here that I'm going to try to get to.
Yeah.
And Dr. Tierney, you talked about the need for transportation to get to doctor's visits, but there are lots of other needs that we know for people to have that mobility, whether it is to get to a grocery store. We know about food deserts and the scarcity of food and what that means for nutrition in children, right? Whether it's seeing family, whether it's getting to a library. So I'm going to combine that with another question we have here, which is a couple of others. I'm going to do kind of a conglomeration of questions here. Combine that thought with what will the mobility bond do for those who are low income, and what will it do for east-west travel?
I think John Michael
I'll
is
take
more of
that
an
one.
expert than I am.
Well,
I've got one for you, don't worry.
Well, one thing we're going to do is provide a diversity of transportation options in more parts of the city. What we're going for are for people to have choices. For those who want to drive, we'll give them that opportunity. For those who want to use transit, we need to give them that opportunity. If they want to bike or walk, we need to give them that opportunity. And that opportunity, as we talked about, the future is not dispersed evenly, neither is access, and we need to disperse access a lot more evenly than we currently have it. And so that's, I think, the long-term, the lasting impact of what this will do. As far as east-west travel, that's a tough one here in Austin, Texas. We don't really have a lot of east-west right-of-way. The east-west opportunities we have, we pretty much got. Unless we want to get back into the business that this city was in several decades ago, of tearing down neighborhoods to build new roads. And I don't think that's likely to happen anytime soon. So, I think east-west travel is going to continue to be a challenge here in Austin until we're digging in the limestone under the rest of the city. But the good news is that the overwhelming majority of our travel in the region isn't east-west, it's north-south. We're a very, very linear city along IH-35. We also have some geographic issues. We've got a big lake kind of in the way. Actually, there's a town called Lake Way. But there's a lake in the way that kind of prevents us from going completely east-west across the region. But we're doing the best we can with what we got with the right-of-way that we have.
John Michael mentioned that we are linear, and we are, but I think we're also creative thinkers. And Dr. Tierney, you've sown some creative thoughts out there. You talked about mobility and the need to get around and having different modes of transportation. And I know that we have at least one person in the audience who's wondering, if we make these changes, if we have transit, if we have bike lanes, will that lead to further gentrification, lead to higher home prices? What do we do then from a population health perspective then with people who are being displaced potentially because they cannot afford their homes and now don't have, again, that mobility access to your health clinics?
Well, I like what Megan said earlier, which is I like gentrification. I just don't like the displacement that goes along with it.
Right.
Which means we have to invest in the neighborhoods and in the people in those neighborhoods so they can stay in place. And part of that is by creating mixed income, mixed use housing that people are willing to go to, that houses people on both ends throughout the economic spectrum. If we do that, and there are examples of that happen around the country, if we can do that, then we can both make places more, better for living and better for health, better for raising families, et cetera, without displacing the people who are currently living there.
And John Michael, I think you live in one of those mixed income neighborhoods, don't you?
Yeah.
Yes.
Yeah.
Miller?
Miller.
Yes.
Again, so you've got 20,000 people. You have a city moving here every year.
Right.
Build it. Don't wait for it just to happen. Build it, and build it so that you make the places that everyone wants to live in. People like me, that I can afford to live wherever I want to live, and people who need subsidized housing. I think what you end up with is a much more diverse, much more interesting community, and especially one that you build transportation into, you build green space, you build housing, you build shops, et cetera. Those are all things that if planned together with the available space, because it's going to happen anyway. If you do it with the available space, you end up with a place that doesn't displace the people who are currently living, in their community for decades.
We need to be intentional, and I know that there are quite a few of you here who are involved in these intentional efforts, and I want to thank you and thank you for your collaboration. We have efforts underway, and we have so many needs for families who need to be able to stay in their homes, for people who need to be able to age in place, right? Catherine, I think you have something you want to add to this, right?
About aging in place?
Yes.
We have 4 senior properties.
Exactly.
And actually, we're trying to find ways for residents to age in place. We have a pilot going on at our Lakeside property. One of our residents, Jan Morgan, taught school for 25 years, didn't learn how to use a computer, came to the first computer class with an article that she had been carrying in her purse for 4 years from the Social Security Administration through AARP saying seniors must be online by December of 2014 or they're not going to be able to get their benefits. And she said, I need an email address fast. And of course that hasn't happened. But people like Jan are learning how to age in place because we're using smart city tools and technologies, and we hope that we can reduce the number of trips on the road by teaching folks how to use, favor. So instead of spending $3 on that bus pass, they could spend $5 getting medication delivered just in time. And Jan is actually going to be testing an RFID tag that goes on her refrigerator.
Wow.
So if she forgets to eat that day, or that the fridge doesn't open, she'll get a text saying, did you remember to eat today? Because she has to eat at certain times for her medication to work correctly. So hopefully we'll be able to see a reduction in the number of readmissions from things like that.
When we talk about being intentional, and we do know that we have a huge issue here with economic segregation and the disparities that we see, but frankly that was intentional. The legacy of 1929 and the dividing line that was drawn in this city how has that continued to affect the health and economic opportunities that we see in Austin today?
It's coming from the outside. I'm seeing this as, you know, I lived for the last 35 years in Indiana. I'm moving here to Austin. I see this, what I'm not used to seeing, which is this economic divide up I-35. And I think it provides us an opportunity to focus our efforts in that area, to say, what can we do for that community that will, you know, if you look at, I think you mentioned it a little bit earlier, if you look at the measures of health and fitness, Austin's actually pretty good. You know, there's a measure from the American College of Sports Medicine of the fittest cities. Austin, of the 50 fittest cities, Austin went from 22nd to 15th last year. But there is this disparity. I mean, that there's about 20% of the population that are not benefiting from that. And if you want to improve the city further, you don't improve the people who are already fit. You don't improve the health of the city by giving resources to the people who already have access to them. You focus it on people who have been ignored, and those people are in northeast,
right.
southeast
And
Austin. Those maps that
the Eastern Crescent.
Optimal health, right. The optimal health maps are compelling. And so that's an opportunity for us to focus our efforts and help the whole community, because the whole community in reality is paying for that. You know, when there's bad health, people they may age in place, they don't die in place. They go to hospitals and they go to emergency departments. They will seek help for their family because they care, and you all end up paying for that in the most expensive, least value-based way.
Well, and that brings up a point that I know was touched on earlier this morning. That is what we call, for lack of a better term, but we all know it, the frequent flyers. Those folks who do not have the access to the hospitable homes, to the education, to the health care. They are homeless. They have the housing insecurity. They are elderly and cannot get what they need, and they are constantly through our emergency rooms. I want, though, John Michael, I know that you've spent a lot of time and you grew up here thinking about and working, as many have here, on an effort with the Eastern Crescent on this issue of our legacy from 1929. If you could address that briefly, and then I'll have each of you give a few minutes of closing comments.
Yeah, well, I think if, you know, we have and it's no secret, we have a tremendous number of disparities in lots of different areas, whether it's access to transportation, income, education, health, you name it, there's disparities here in Austin. And you know, if one can find a silver lining to that, and it's really hard, is that at least we know where it is, and all of those disparities happen to be in the same places. And that is the Eastern Crescent of the region. And you know, I think that's why the mayor and his team and the manager and several other council members, I think, very wisely began to talk more about how we can address those inequities that have been around for a long time, that have created this situation where we have a tale of two cities, right? And the Spirit of East Austin initiative is what they ended up calling it. And if nothing else, if we start to talk about that area more as that is the future of our city, you know, we're gonna, you know, we've done enough downtown, we can't screw it up, right? It's gonna be great. You know, there's parts of Austin that, you know, have some challenges, but they're gonna be just fine. The future of this city and the future of this region is really tied to how much time and attention are we paying to the outcomes in that Eastern Crescent. Again, we can keep our heads in the sand and read our own press and pat ourselves on the back, aren't we all proud to live in Austin? Or we can be very intentional about, this is where we need to turn our attention, this is where we need to invest, this is where our discussions need to be about. You know, before I started working for the mayor, you know, I'd never really worked in city government before, just been a very interested observer, and I was shocked about how much of our agenda as a city and how much of the discussion at the city is dominated by what happens within a mile or two of downtown, right? We will spend 6 hours in a council meeting talking about a rezoning of a parcel in a neighborhood that, you know, I mean, it's important. Don't get me wrong. That's the most important thing on a lot of people's agenda. But we have real problems in the Eastern Crescent. And the more we can start to shift our agenda and the amount of time that we're discussing and wringing our hands about those issues rather than others, I think the better off we'll be as a city and a region. And I'm glad that conversation has started.
Thank you, and thank you for getting us back to asking the right questions and to are we being an effective city and effective in what fashion and outcomes, actual outcomes. I think that we are drawing to a close of our time, and so I'm going to ask each of you to just give 2 or 3 minutes for your concluding thoughts, and thank you for your participation in this panel. Catherine.
Well, HACA is one of the top performing housing authorities in the United States, and part of the reason for that, per HUD, is because we do provide safe, decent, affordable housing. We're a housing social safety net. But on the family self-sufficiency side, when a resident moves out of public housing, it leaves a place for that next needy person. And so we're only able to do that through our partnerships. Our partnerships are really key. This conference has been tremendous in terms of helping us ask the question, how can public and affordable housing, how can a public and affordable housing home be a vaccine in a smart city? And we'll rely on our partners like Family Elder Care and Boys and Girls Club and Skill Point Alliance to help us get there. Lifeline Services, and it sounds like we're going toward open data, where we have a deliberative, democratic process for engaging citizens in transportation spending, but we need everyone's help to push technology adoption so that our residents can adopt that technology and their information can also be integrated into what we're seeing in smart cities. Because how smart can a city be if some of its residents aren't connected? If our residents' data are not in the smart cities databases, how smart can we be? And then finally, I just reiterate what John Michael said about learning. We want to be a learning organization, and that means moving from information to knowledge and assembling that with our partners, and then ultimately to intelligence, to being smart. Thank you.
John Michael.
Well, I guess a parting remark is, we'll need all of your help. I think we have a really great opportunity here in Austin, Texas to address a lot of the challenges that we're facing. I think we're in a unique moment in time. We have the good fortune of a lot of resources coming to this city, a lot of talent, a lot of investment. We have all the tools we need here to really do something about the problems that have been vexing us as a community for a long time. We just have to have the will to do it. I would say rather selfishly, or in a self-interested way, that I think you also have political leadership in this city and this region now that wants to do that, and that is unafraid to try things and to try big things, new things, novel things, in hopes that we can actually move the needle on some of these challenges. And we'll need your help first with ideas. Bring us ideas. But I would say, don't just bring us any ideas. Bring us ideas that actually solve a problem that we have, that do it in an equitable and inclusive way. And this is important. Bring us things that we can take to scale, right? Because we don't want to just do a good thing and pat ourselves on the back. We want to do big things that are really going to move the needle, because we are so far behind in so many areas, and with our growth, the challenges that we face today are only going to get worse faster. So we have got to catch up, and we have got to take the best ideas and take them to scale. And I think you have an opportunity now to do that. And those of you who don't bring us the ideas, support your leaders and the institutions that are taking a risk and are trying things and are taking bold steps, because they very well may fail. But you need to support that and embrace that and encourage them to keep trying things and to make and take big steps.
And last but not least, Dr. Tierney, a couple minutes of closing thoughts.
I have almost nothing to add to what John Michael just said.
All right.
I mean, I agree with everything he said, and he said all the things that I was going to say. So all I can do is cheerlead.
Okay.
All I can do is cheerlead, is that you've got an unparalleled opportunity here. You've got recognized problems. You've got a new structure of your council that allows, that is now inclusive. You've got an equity officer for the city. You've got economic development. You've got people wanting to move here, but at both ends of the socioeconomic spectrum. And you've got great organizations here who are all doing great stuff, but not necessarily together. We need to get the builders together with the technology people, with the city and with the health people to build communities for these 20,000 people who are moving in here every year, so that, envision a community that has people from all SES states and all races, all ethnicities, that has a YMCA and a medicine clinic and an HEB store and green space and transportation downtown. This is achievable now, and the Federal Reserve tax incentives actually help pay for it. If you build in the kinds of incentives to bring in people of mixed economies, you've got an unparalleled opportunity here to do something with it, or you could blow it. You could do nothing. You could be a dumb city. And I would argue that nobody in this room is interested in this being a dumb city. And I think you've got all the pieces. It's just a matter of the pieces have to be energized and collaborate together. And every year, just think you got to build a 20,000 person city.
So we have the challenge to move forward in a smart fashion, ask the right questions, be inclusive, look at our data, be transparent. And with that, I would say how delighted I am and how honored I am to have been here with all of you. Thank you to our panelists and to all of you for participating. Thank you so much.